back to Central Valley today. If you experience frequent, reoccurring, or chronic pain, then you understand how it can get in the way of you living your life. It's why Dr. Goswami started California Pain Consultants, to help people with innovative breakthroughs for pain management so they can start living again. So I am here now. We're inside one of the procedure rooms here at the Herndon. This is the Herndon Procedure Center where you do your surgeries for California Pain Consultants. So thanks for inviting us out here. It's an exciting day here.
Yeah, thank you for coming out.
So you have a couple surgeries today. We're going to see one in another segment. What other surgeries are you performing today?
Well, there's a lot of different procedures that we do here at Herndon Surgery Center, you know, all the way from simple epidural steroid injections to nerve blocks and nerve ablation therapy for back pain. We also do more advanced procedures like spinal cord stimulation trials and implants, which we'll be doing later today. We do sacroiliac joint fusion therapy for patients who have sacroiliac joint pain, and also things like interspinous indirect and direct decompression procedures as well.
How often are you performing surgeries, or how often are you doing procedures here at the surgery center?
I come to Herndon Surgery Center once a week, but I'm doing procedures twice a week.
Okay. How often are you recommending these kinds of treatments? Would you say it's more so you're bringing patients here, or are you doing other therapies outside of the surgery center?
I think it's a combination of both. You know, we do the right type of therapy for the right patient. That's the main thing. Mm-hmm. And at the end of the day, I think that less is more. You know, if we don't have to bring them back that often
Yes.
to do different procedures, I think the better for the patient. And it's more of a longevity thing, and this helps. These procedures help to complement other things that we provide for patients, whether it's mental health therapy, whether it's physical therapy, exercise therapy, whether it's yoga, meditation, and things like that, to help bring the entire picture into place as to what is actually happening then with their pain.
It's so funny that you talk about mental health therapy, because I was just talking with a physician this morning about, you know, he works in a totally different field, but psychotherapy is a big part of what he does to help people manage their diseases and help people. And I would assume that if you're living with chronic pain, and you have been for a long time, that psychotherapy is really important to deal with living that way. How do you get to somebody comes in to visit you with pain, they've had it for a long time, how do you get to the treatment plan? How does that happen?
I think that, you know, we see the patients in the office, and after doing a careful history and physical exam, after reviewing certain labs or in particular imaging studies with them, we talk to them about what their pain is and what their limitation is in life. And depending on that and what type of pain they present with, we want to present a type of therapy and action plan for them. And everything is such that patients like to have plans.
Yes.
And if you have a plan for them, they feel as though they're getting somewhere and will be able to go somewhere. And these plans are always tied in with their activities of daily living, what they are, what they're not able to do. Mm-hmm. And we always say to patients, what can't you do now that you want to be able to do after this procedure? And let's see how well that works and see how far we get with that.
I think that's a great measurement for success, because I think we've talked about this before. Mm-hmm. Sometimes the measurement for success isn't pain-free. The measurement is, I want to do this thing, I can't do it right now. Let's get to a place where we can do that.
Yeah.
What are your testimonials? How, when people come to see you, where are they in their pain management journey?
Well, I think each person is in a different place.
Sure.
And a different space. You know, that's what pain is. It's very personalized, but we try to quantify it as well. And so it just depends on the patient, whether they're experiencing pain for the first time. Usually chronic pain is what we deal with, and so these are patients that have had pain for several months, several years.
Right.
And you're absolutely right, you know, in terms of mental health aspects of pain. Studies have shown that 60 to 70% of patients who suffer from chronic pain also have mental health issues, such as depression or anxiety disorder and things like that. And so addressing those things outside of the OR make the experience in the OR a lot better for the patient.
Yes, it is. It's fascinating to see how your brain can manifest these symptoms in the way your body feels physically. So if we come to California Pain Consultants, we come see Dr. Goswami, what is the experience like? What's the treatment like? What will our patient experience be for the lifetime that we see you?
I think it'll be a very pleasant experience. I think it'll be a very empowering experience. I think that, our goal is to listen to patients and see what they're coming in for, and then develop a plan that works best for them for their pain algorithm. I think that doing procedures is one of the bread and butter things that I do in interventional pain medicine, and so if we can do a procedure that lasts several months, several years for a patient, in which we're able to get them off of pain medication, we're able to get them to be more active, if we're able to get them to educate them about their diet and exercise and things like that, I think then that's a goal and that's a win for both.
Well, empowering is such an important word, because when you are in pain, I have had several back spasms, I lift a lot, and so when you're in pain, you feel powerless. Absolutely. So empowerment is such an important word to hear from your pain doctor. So Dr. Goswami, California Pain Consultants, we will have all the information on how to get in touch with them, how to set up an appointment, and then we're going to see some procedures. So you're going to want to stay tuned to Central Valley Today. So thank you so much for inviting us out here.
Thank you.
Well, if you're having issues with your roof, Lightning Roofing can help you in a flash. We're on location with the family-owned business next.